Good morning. I'm Dr. Michael Douglas from New South Wales Health with the COVID-19 update for Thursday the 30th of December 2021. Across New South Wales, 95% of people aged 16 years and over have received the first dose of COVID-19 vaccine, and 93.5% have received 2 doses. Of the people aged 12 to 15 years, 81.5% have received a first dose of COVID-19 vaccine, and 78.1% have received 2 doses. There are currently 746 COVID-19 cases admitted to hospital in New South Wales, with 63 people in intensive care, 24 of whom require ventilation. There were 12,226 cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night. More than 97,000 COVID tests were reported during that same period. Sadly, New South Wales Health today is reporting the death of a woman in her 70s from the Central Coast who died at Wyong Hospital. She was a resident of the Hakia Grove Aged Care Facility where she acquired her infection. She was not vaccinated and she did have underlying health conditions. New South Wales Health expresses its sincere condolences to her loved ones. A reminder to everyone across New South Wales to get vaccinated now if you have not already had your first dose, and to get your second dose as soon as it is due. We continue to see an overrepresentation of unvaccinated people admitted to ICU. Thank you to everyone who's come forward to receive your booster vaccine. New South Wales booster program continues to ramp up as more people become eligible, with New South Wales already delivering more than 200,000 vaccine booster doses to keep people safe and to increase the levels of immunity against COVID-19. People aged 18 years and over are eligible for a booster after receiving their second dose. If you haven't yet booked in for your booster, please visit the New South Wales Government website and make your booking today. New South Wales Health advises to get tested for COVID-19 if anyone has symptoms and to self-isolate until you receive a negative result. This public health advice applies to everyone, even people who are fully vaccinated, partially vaccinated, or not vaccinated at all. Testing capacity in New South Wales is currently under enormous pressure, and only people getting a PCR test should be those who have symptoms, who live in a household with a confirmed positive case, or otherwise have been advised by New South Wales Health to have a test. Around a quarter of the people exposed to COVID-19 may still develop their infection after 7 days. For the subsequent 7 days, people should continue to exercise caution and not enter a high-risk setting, should avoid large indoor gatherings, and if possible, use a rapid antigen test if coming into contact with vulnerable people. Get tested and stay home if you have the mildest of symptoms. Do not visit family, friends, or go to social events if you are unwell. Wash and sanitize your hands regularly. Rapid antigen testing can be an additional precaution that you can take if you are planning to socialise, particularly with large groups of people, indoors, or interacting with people who are elderly or have serious health conditions. When socialising, remember to take sensible precautions that include physical distancing, meeting outdoors where possible, ensuring good ventilation indoors, such as opening the window. Again, thank you for your continuing efforts to be vaccinated, to get tested, and helping to limit the spread of COVID-19 in the community. Please stay safe.